I'm Dr. Bart. In this, we are going to the causes of boils section. Opportunity to look at actual law practice. In this barotrauma, we are going to look at the for in a number of anatomical. It's typically non-pulmonary trauma. We the longest to experience action of gas, and specific areas concerned in descent and or depression and phase of hypertherapy. Typically, the distinction between what is referred to as descent compressed. The term is used in some of the hair hyperbaric. That is, people were placed chamber compressed a greater. People refer to descent. Now, in class, the concept of ascent barotrauma. Ascent barotrauma, talking about of intracapital pressure. Take a moment here to expand the concept of descent barotrauma. What exactly do you mean by negative intracapital pressure? For purposes of let's talking sinus. The patient sea level pressure is 60 millimeters. As we compress the chamber, everything around this is in. Now, if it is blocked, it cannot. So the sinus is sea level, despite the fact that the pressure in the now is so. Say that the pressure is at 7. We increase the pressure to 780. So the pressure is 780. Sinus pressure at sea level 6. Relative on in the chamber, this is negative cavitary. Now, these two orders, ascent trauma, is really a problem because individuals do operate very well. This is cavitary, and we are calling edema of fluid. If you further this pressure, that the difference, the pressure, and the greater will become. Barotrauma is referred to as positive pressure. Again, this is an example. Let's say in the chamber hour, they came in, sign you and down and now for some of treatment. A little additional swelling they have off the eye to the. You begin to back surface sinus in this patient ATA atmospheres. The pressure in that is about 50 millimeters. Absolutely. Now, the chamber pressure of 15. We begin to surface increasing from 100 to 50 to 100. So, relative going on in the chamber, this is positive intracapital pressure. Now, disorders, ascent is less typically tolerate pressure well. Not tolerate vacuum. Sometimes ask, would you prefer to have pressure ball vacuum to your eye? well, you're going to prefer a little bit of pressure, and we saw the tissue compress well, not tolerate. Practical point, it's used. Deep trauma is common than descent. This is fortunate. It means you have a great deal of getting patients to pressure, but you're rarely problems getting from pressure. Now, areas to Barotrauma, it will be the potential within the middle ear, most common disorder. And people ask, what to keep your tongue, hyperbaric. One clearly man middle ear problems. We can have difficulties with the middle ear. You may wonder, on earth could the be a problem? Well, it's space. About that. And the inner ear also barotrauma. Again, you may, but the inner fluid and we are not. That concept also in the session. Sinus have already indicated certainly be to barotrauma. Also have spaces. For example, you may be how it is tooth could fall trauma. The or dental potential. Of course, there's a track, a gas organ. Finally, we full of any goes in the chain potential. Probably one important to think of patients with skill to tracheostomy, these cups at the end. And in accordance with all those cups very functional. So let's now to ear. If we consider the internal ear, and then we see the middle ear. The middle ear to via to the use typically will begin and function 20 millimeters of mercury. The patient equal pressure by the time you reach millimeters of mercury. There is a possibility that they will experience a great pressure can out to as 100 millimeters, and the ear fail altogether, and you have rupture. The eustachian dynamic say it's not open on a continuous basis. Patients may have trouble, perhaps the head by titus or they were left with tissue and ever bother difficulties to pop up. Now, to descend, we are experiencing descent trauma happens in a graft, negative cavitary. The deeper, the greater effect. We get edema is usually the engorgement of in blood, middle ear. The ear pulled or retreat inwards. Symptoms, imagine, would have ear pain, decreased. On examination, we can find changes in itself. Changes applied or as the is not enough for anything. It's Lieutenant Teed, who came up with jail. Imagine Lieutenant Teed was in charge of looking at a whole Navy dive, and probably charting. The ear is red, the ear has petechiae. Simply killed the hand. Which is common in medicine. We find the pedis has fracture class, the cards have theirs. In hyperbaric, many people use because it's a time saver. Universally recognized. So here are the elements of the individual has without the patient that their hurts you and you really don't do anything remarkable. Grade. This would be who redness. See here. The photograph left is a picture of a drum, and we have an artery. That more than you might notice here, just too much going down the bow. Grade. What is? Well, it has everything. One, but also know that you have some little that are grade 3. Grade 3 has grade 1, redness, petechiae 2, and then it has a little bruise. You'll notice areas are of a grade. Now, an easy for this 3 fine with grade 2 fine. 2 fine are redness, and then the grade 3 redness, eye, bruising. What is grade? Grade referred to very ear. For some, it may be reminiscent of a fracture. The entire middle ear is blood. So you suppose grade 5 would be? Well, tested with actual tympanic itself. Clinical, you can typically see patient grade 0, 1, or 2. That is to say, severe pain, findings, redness, a few petechiae. Unusual patients with grade 3 or grade 4. For that to have to be true attentive, the patient would have a deal of to see this kind of thing or bleeding. So what is we can do in terms of cleaning up or equaling that pressure? You know, there are certain factors that build up disequal pressure. Poor tech who don't to clear their upper infection, these mucosal symptomatic like intestines, the ED, allergic, and certainly steroids, they mucosa, and in rare cases steroids also be factors, risk factors, smoking, patients who have had radiation. Later on in the show, we'll talk about HB management of these individuals with very large radiation. There's a certain